We're joined now by Dr. David Strain, the co-chair of the British Medical Association's Medical Academics Staff Committee. Good afternoon to you.
Good afternoon.
So, from a scientific point of view, why has the World Health Organization changed their guidance, do you think, which is prompting this rethink from the governments of the four nations here in the UK?
We are constantly evolving the evidence that we have for how to best protect both our children and the teachers in schools. There is still no 100% clear evidence either way for whether children can or cannot transmit infection. However, given that the Chief Medical Officer last week said we are very close to the limit of the easing of lockdowns that we can instigate, and this would be a further easings, it seems very sensible to use whatever measures that we have at our disposal in order to maintain our children at school so that they can resume their educational process.
Do you think that the impact will be huge then in terms of reducing the cases? Because it's my understanding that the only people this really benefits, it's not people wearing a mask that stops them inhaling the virus. It's if somebody has the virus and they don't realise they have it, it sort of minimises to an extent how many other people they infect. But only, of course, if the mask is fitting perfectly well, which most aren't.
I mean, you're absolutely right. The main aim of the face covering is to protect the people around us. And the idea is that it would catch whatever virus that you're having and stop it spreading onwards. And the difficulty we have, particularly with children, is they don't get the same symptoms. The classic symptoms for the respiratory, the influenza type symptoms that adults are seeing, we don't see that in children. And it's uncertain as to whether the absence of symptoms means simply that we are just not recognizing COVID in these children, or whether their absence of symptoms means that they're actually not infectious. Ideally, we'd love it to be the latter, but given that there is uncertainty, it makes sense to plan for the former. We need to plan that they could be carrying the virus, not displaying the symptoms, and therefore not know they are potentially spreading it to people around them.
It's interesting, though, isn't it? Because Public Health England yesterday published a report which was of the sort of mini-term that we saw in the summer, which found that only 2 cases out of 30 outbreaks involved student-to-student transmission.
Yeah, I mean, I agree entirely. We are dealing in an area that we don't have the full data available at the moment. In Dundee last week, we saw one school being closed down with 27 cases there, which appears to have been initiated from 2 children, although most of the cases were staff. We don't know this for certain yet, but until we have some certainty, it just makes sense to provide whatever mitigation we can do in order to maintain children safely in school.
I just wonder, finally, if you think that perhaps more emphasis should be put on making sure that there are enough tests, because we've seen from Nicola Sturgeon today that over the weekend demand outstripped supply of tests following the resumption of school a couple of weeks ago there. Do you think we're prepared well enough for the increase in demand for tests here in England?
Well, at the British Medical Association, from the outset, we've been saying we need a greater availability of tests to anybody who potentially could be carrying the virus. Although we do have to accept the fact that the test itself is still not 100% accurate. It still can miss people, particularly in the early stage, who are carrying the coronavirus. And therefore, we could be falsely reassuring some people. And that's why we still have the importance of the quarantine, the self-isolation, and all of those personal hand hygiene measures that will help reduce any potential spread.
OK, sensible words from Dr. David Strain there. Thank you very much.